Hi there, this is Scott Yaruss from Michigan State University and Stuttering Therapy Resources. I'm here with the third in our series of brief videos about fluency and about what that word means and how or whether we as speech-language pathologists should use it. If you've been following this series, you've already heard my friends and colleagues, Dr. Seth Tishner, Dr. Chris Constantino, talking about their perception of what that word fluency means for them as people who stutter, what it means for them as scientists and researchers, and what it means for them as clinicians. What I hope to do in this brief video is talk about what that means for us then in terms of our daily practice. Can we use the F word? Should we be talking about fluency disorders, or is there a better way to do that? That's what I want to talk about. We're not saying that you can't say fluency. Let's just start there. We are saying, however, that thinking about stuttering in terms of fluency is very limiting for understanding the experience of stuttering that people who stutter live in their daily lives. If we hold up fluency as the ideal or as the standard, then that in and of itself creates a situation in which people who stutter are less than, or are disordered, or disabled, or handicapped. And we can change that perception by simply recognizing that the condition that we work with is not fluency disorder, but rather stuttering or cluttering. We can be specific about the name and nature of the condition because that helps to describe it not in negative terms, not in terms of the absence of something or a problem with something, because it's important for us to recognize that yes, many people who stutter do experience challenges and problems in their lives. Of course they do. But it is our goal as clinicians, as members of the self-help and support communities for people who stutter, it's our goal to diminish that. And I know many, many people who stutter who would not say that they're disordered, that they're less than, that there is a problem. They may exhibit a variation. They may exhibit a difference in their speech. They may exhibit stuttering in their speech. But this does not mean that they are necessarily disordered. And talking about people in those terms conveys a judgment that we don't need to and should not be putting on other people. When we talk about fluency clients on our caseload, we're defining them by the absence of something or by a problem with something, rather than defining them as people who exhibit a characteristic. So one concrete way that we as speech-language pathologists can make a difference in how stuttering is viewed is not to talk about fluency clients, fluency kids, fluency sessions, fluency goals, fluency disorders, but instead talk about, I have kids who stutter on my caseload. I work with people who stutter. I have goals related to helping people cope with, manage their stuttering. Now, does this mean fluency plays no role? No, doesn't mean that, because as you learned from the other videos, even when we start to talk about fluency, it's still not clear what that means. People who stutter can be fluent on the surface, at least so far as a listener can judge, yet still inside be stuttering. So fluency is potentially inaccurate in addition to being a negative definition, in addition to being an exclusion definition. Now, let me just acknowledge, when you're writing a report for an insurance company, sure, they're expecting to see a diagnostic code of F80.81, childhood onset fluency disorder. Fine. We're stuck with that. Use fluency disorder when you need to. Use it for your diagnostic criteria if you have to, right? But when you're talking to and about people who stutter, let's show them the respect of not defining them by some arbitrary standard that in and of itself is not well defined, and simply refer to their difference in neutral, open, and accepting terms. There's much more to say about this. Keep watching us here at Stuttering Therapy Resources as we will continue to explore this cutting-edge frontier of how to talk about and think about stuttering and people who stutter. You can find all of our materials on our website, stutteringtherapyresources.com. Thanks very much.